Welcome to an in-depth look at hypertension, commonly known as high blood pressure. It's a condition that affects millions worldwide, often without noticeable symptoms, earning it the ominous title of the silent killer. But what exactly is hypertension, and why is it so dangerous? Blood pressure is the force of your blood pushing against the walls of your arteries as your heart pumps blood. When this pressure is consistently too high, it's called hypertension. Over time, this elevated pressure can damage your arteries and lead to serious health problems. Understanding hypertension is the first step towards managing it and protecting your health. Let's break down what your blood pressure numbers mean. A reading consists of two numbers, systolic and diastolic pressure. Systolic pressure, the top number, measures the pressure in your arteries when your heart beats. Diastolic pressure, the bottom number, measures the pressure in your arteries when your heart rests between beats. Normal blood pressure is typically considered to be less than 120/80ths mmHg. Hypertension is generally diagnosed when blood pressure consistently reads 130/80ths mmHg or higher. There are different stages of hypertension, from elevated to stage 1 and stage 2, each requiring different levels of attention and intervention. Regular monitoring is crucial for early detection and management. Hypertension can be categorized into two main types: primary essential hypertension and secondary hypertension. Primary hypertension accounts for about 90–95% of all cases. It develops gradually over many years, and there is often no identifiable cause. However, a combination of genetic and lifestyle factors plays a significant role. Secondary hypertension, on the other hand, is caused by an underlying condition, such as kidney disease, thyroid problems, sleep apnea, or certain medications. This type often appears suddenly and can be more severe than primary hypertension. Several risk factors increase your likelihood of developing hypertension. Age. The risk of high blood pressure increases as you age. Family history. If your parents or close relatives have high blood pressure, you're more likely to develop it. Obesity. Being overweight or obese significantly increases your risk. Physical inactivity. A sedentary lifestyle contributes to higher blood pressure. High sodium intake. Too much salt in your diet can cause your body to retain fluid, increasing blood pressure. Low potassium intake. Potassium helps balance sodium levels in your cells. Excessive alcohol consumption. Heavy drinking can raise blood pressure. Stress. High levels of stress can temporarily increase blood pressure. Smoking. Nicotine raises blood pressure, and chemicals in tobacco can damage artery walls. Certain chronic conditions, diabetes and kidney disease, are closely linked to hypertension. One of the most concerning aspects of hypertension is its often asymptomatic nature. Many people live with high blood pressure for years without knowing it, as there are typically no warning signs or symptoms. This is why it's called the silent killer. When symptoms do occur, they are usually not specific to high blood pressure and can include headaches, shortness of breath, nosebleeds, or dizziness. However, these symptoms usually appear only when blood pressure has reached a dangerously high level, indicating a hypertensive crisis. The only way to diagnose hypertension is through regular blood pressure measurements. This can be done at your doctor's office, at home with a personal blood pressure monitor, or at public screening stations. Early and consistent screening is vital, especially if you have risk factors. Your doctor may recommend several readings over time to confirm a diagnosis. Untreated or poorly managed hypertension can lead to severe and life-threatening complications, affecting various organs throughout your body. Heart disease. High blood pressure forces your heart to work harder, leading to thickening of the heart muscle, heart failure, and coronary artery disease. Stroke. Damaged and weakened blood vessels in the brain can rupture or become blocked, leading to a stroke. Kidney disease. High blood pressure can narrow and weaken the blood vessels in your kidneys, impairing their ability to filter waste from your blood. This can progress to kidney failure. Vision loss. Tiny, delicate blood vessels in the eyes can be damaged, leading to retinopathy and potentially blindness. Peripheral artery disease. Narrowing of arteries in the legs, arms, and stomach can cause pain and increase the risk of heart attack and stroke. Dementia. Chronic high blood pressure can affect blood flow to the brain, contributing to cognitive decline and vascular dementia. Aneurysm. Constant high pressure can weaken blood vessels, causing them to bulge and form an aneurysm, which can be fatal if it ruptures. The good news is that hypertension is manageable. Treatment typically involves a combination of lifestyle modifications and, if necessary, medication. Lifestyle changes. These are the cornerstone of hypertension management and can often prevent or even reverse early-stage hypertension. Healthy diet. Adopt a DASH diet, rich in fruits, vegetables, whole grains, and lean protein, and low in saturated and trans fats, cholesterol, and sodium. Reduce sodium intake. Limit processed foods, canned soups, and fast food. Aim for less than 2,300 milligrams of sodium per day, ideally even less. Increase potassium intake. Foods like bananas, potatoes, spinach, and avocados are good sources of potassium. Regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity activity per week. Maintain a healthy weight. Losing even a small amount of weight can significantly lower blood pressure. Limit alcohol. If you drink alcohol, do so in moderation. Quit smoking. Smoking cessation is one of the most impactful steps you can take for your cardiovascular health. Manage stress. Practice stress-reducing techniques like meditation, yoga, deep breathing, or spending time in nature. Adequate sleep. Aim for 7-9 hours of quality sleep per night. Medications. If lifestyle changes aren't enough, your doctor may prescribe medication. There are several classes of drugs used to treat hypertension, including diuretics, ACE inhibitors and ARBs, beta blockers, calcium channel blockers, alpha blockers, and renin inhibitors. Your doctor will determine the best medication or combination of medications for you based on your individual health profile and other conditions. Preventing hypertension is always better than treating it. Many of the lifestyle changes used for management are also effective for prevention. Regular checkups. Even if you feel healthy, regular visits to your doctor for blood pressure checks are essential, especially as you age. Educate yourself. Understand your family history and personal risk factors. Adopt a heart-healthy lifestyle early. Instill good habits from a young age. Monitor at home. Home blood pressure monitoring can provide valuable information to your doctor and help you stay on track. Living with hypertension means committing to long-term management. This includes adherence to treatment and consistent lifestyle. Regular monitoring. Keep track of your blood pressure readings and share them with your healthcare provider. Open communication with your doctor. Discuss any concerns, side effects, or changes in your health. Support system. Lean on family, friends, or support groups for encouragement. Hypertension is a serious condition, but it is not a death sentence. With awareness, early detection, and consistent management, you can significantly reduce your risk of complications and live a full, healthy life. Take control of your blood pressure today. Make healthy choices, monitor your numbers, and work closely with your healthcare team. Your heart and your entire body will thank you for it. Thank you for joining us in understanding hypertension. Stay informed, stay healthy.